Darren Henry.
Madam Chairman, it is a pleasure to serve under your chairmanship. I'd firstly like to thank the Honourable Member for Worsley and Eccles South for calling this debate. I'm pleased to be here today to speak on what is such a crucial topic. I'd like firstly to reflect on the last 10 years since the Winterbourne scandal, and secondly to look forward and ensure what we learned from the horrific events that occurred cannot happen again. What that BBC Panorama programme exposed was absolutely shocking, disgusting and heartbreaking. The programme revealed patients with a learning disability and or autism being repeatedly pinned down, slapped and taunted by staff. This community was let down. Following this, the government promised to transform care for people with learning disability and or autism by 2014 by supporting those in assessment and treatment units to move out of these settings and get the right support in the community. It is my belief the government still have a long way to go before they achieve what was promised. It is now vital that we continue to learn from Winterbourne. This government has shown that it is willing to make the necessary changes by publishing the white paper on reforming the Mental Health Act, and I would like to commend the reforms that it has set out. I would also like to send my personal thanks to the Department for Health and Social Care, as well as the Lord Chancellor, for driving forward reform to the Mental Health Act 1983. The Act has long been outdated, and it is my hope that engaging many of the recommended changes will fire the starting gun on changing the way our country views and treats mental health conditions. There is a clear desire set out in the white paper to change the culture surrounding mental health, and to do this by enacting a person-centred approach to care. This is a new approach to the way in which our mental health services run, and will begin to achieve the desired goal of bringing the Mental Health Act in line with 21st century principles in medical care. Now, having spoken to stakeholders including Mind, the National Autistic Society, Rethink Mental Illness and Mental Health Foundation, I would like to share the conclusions I have drawn on this topic and the lessons I believe must be learned following the atrocities of Winterbourne. So, broadly speaking, they are ensuring the shift from inpatient care to one of care within the community is backed with a commitment by government to provide community support services. 2, making sure all inpatient facilities are taking into consideration the requirements of all their residents, as well as ensuring when individuals are ready to be released, the right care in the community is in place for them. And thirdly, in order to prevent situations reaching a stage where individuals have to be placed in an inpatient facility, we must place emphasis on early intervention. I applaud the long overdue decision in the white paper to remove autism and learning disabilities from the definition of the mental disorder in the Mental Health Act. For too long, autism and learning disabilities have been grounds for detention under the Mental Health Act. I also welcome the commitment to build new mental health hospitals, with 2 schemes already approved and more to come. And we'll tackle maintenance work needed in the mental health facilities where patients are treated. However, I believe that it is essential before new projects commence that we ensure all new facilities are built taking into account the needs of those with autism and learning difficulties. Removing autism and learning disabilities from the terminology of the Act will not mean that individuals with autism and learning disorders will not suffer from poor mental health and require access to those facilities in time. Therefore, we cannot continue establishing new mental health facilities that are not constructed with all those who will access them in mind. The needs of those with autism and learning difficulties may be different from others who are accessing inpatient services, and these needs must be catered for. I would welcome a new approach to the creation of inpatient facilities that means the needs of those with autism and learning disabilities are given greater consideration. The White Paper states that care and treatment reviews will have statutory force in order to help address the issue of inappropriately long stays in inpatient units. This is a welcome development and one that will ensure that people with autism and learning disabilities do not become trapped in inpatient care. 2,040 people who have a learning disability and autism remain detained in inpatient settings. 59% of those people detained in hospital have had a length of stay of over 2 years. I believe this is simply not good enough. However, there are other barriers in place in existence, ensuring individuals are not being released from inpatient care at the appropriate time. And this is a lack of programs and facilities to be released into. Without the appropriate resources in place, individuals are becoming trapped within facilities that may no longer have the correct environment. I spoke about this topic today with one of my constituents in Broxtowe, Chairman of the Board of Trustees at Autistic Nottingham, Justin Dunn, who had this to share. What has become clear in our communities is that the suffering of autistic people being locked up is needless, as our advocacy, social and personal assistance services have successfully kept most of our service users out of that condition. Moreover, we get occasional requests from outside our geographical remit, which is Nottinghamshire, regretting that they do not have the appropriate facilities in their location. This proves we obviously need to significantly invest more funding in organisations such as ours, that's Autistic Nottingham, who provide real tangible help that benefits both the individual and the community and saves money and hospital resources by investing in essential preventative services. The National Autistic Society's vital community work is testament to just how successful community support can be in supporting individuals outside of an inpatient facility. More must be done to address these issues, and I look forward to the government's comments in this area in particular. I would welcome a commitment to evaluate and improve upon services currently in place across the UK that support individuals with autism and learning disabilities when leaving inpatient facilities. The government have committed £31 million of mental health recovery funding for a range of projects, including admission avoidance and quality of inpatient care. I would welcome a breakdown from the Minister of what specific projects will be funded. The focus of the White Paper is that of a new person-centred approach to care. By putting the individual at the centre of their own treatment, it enables them to make their own decisions surrounding care and results in a more tailored approach. For those with autism and learning disabilities, it is even more vital that their care is centred specifically around their specific needs. The introduction of a statutory advanced choice document will go a long way in ensuring this is acted upon and to enable people to express their view on care and treatment that works best for them as inpatients. And that's before the need arises for them to go to hospital. As this White Paper states, putting these plans on a statutory footing for the first time will require them to be developed in good time and partnership with patients. My concern around shifting the emphasis of care away from inpatient facilities to community support lies around whether properly established and funded support is in place in the community. The NHS long-term plan established a commitment for increased community support for early mental health intervention, which is echoed in the White Paper. I welcome a detailed outline of what this expansion of community support will look like at all levels, how, when it can be expected, and how it will be implemented across the UK to ensure that all areas of the UK have the same levels of support. As I have stated, we need to focus on prevention, and if that is not possible due to the complex needs of the individual, then how can we ensure individuals with learning disabilities and autism in hospitals are safe, respected, and their dignity is maintained and their human rights not violated? I spoke recently with another constituent of mine, Ashley Swinscoe, who does vital work in my local community, supporting those with autism and or learning disabilities within our local community. He discussed early intervention and proposed that schools need to offer support to individuals until they are 21 years old. Through this stage, consistent support is offered from childhood to adulthood. This consistency would help the individuals manage the stress caused from the changes in life. This would also reduce the risk of increased behaviours and mental health decline. So I'll finish now, Madam Chairman, by just saying, if individuals are not ready for supported living and require residential care, then providers must also offer supported living in the future. Residential care is not long-term, and providers promised to progress individuals to become more independent with less restrictive and move to supported living. So that's a suggestion there from Ashley Swinscoe from my constituency. And I'll finish there. Thank you.